Everyone, we're here with the mom of the 4-year-old boy who was having such horrible seizures that they wanted to do a temporal lobectomy on him, which is not good. Removing the anterior portion of the temporal lobe. The temporal lobe is your memory, for one thing. And with a 4-year-old boy, ooh, that's tough.
Mhm.
So we did a video with the mom and dad a while ago, and now we just want to update and let everybody know everything and how he's doing and what's happening. So, welcome, Mom. And why don't you just tell us how your son is doing now and what's happening?
He's doing way better. His seizures, they were around 3 to 5 minutes, and whenever we started the treatment with you, they're now around 10 to 15 seconds.
So, it's a lot less of a time
Yes.
that he's in the seizure. And are his seizures overall been less?
Yes.
Yeah. So
They.
that's ultimately what we're doing. And for those of you who missed the first video, it's up in my playlist. But more importantly, we are utilizing homeopathics to remove underlying toxins and infections. We're utilizing red light. We're utilizing magnets. We're utilizing neurological protocols, which we haven't gotten to yet. So, what was happening and how did it happen? What he started having seizures very early on. Just give us a little history briefly. And everyone, she's very nervous. So I don't want to see any negative comments in the comments because if there is, you're gone. It's block and delete. So be nice to her. So, yes, just give us a little history, please.
Well, he started having seizures when he was 3 months old.
Yeah.
Whenever he got COVID, and then he had a high fever of 103, and his seizure was about 30 minutes.
Yeah.
And
That's
then,
a that's a
yeah,
long time, and it was an clonic tonic seizure.
yes,
You, yep,
yes,
yep.
his whole
So
body. And
yes, and that's what that means for those who don't know. It's a whole body seizure. Yes, right.
and then from there, they started him on Kepra,
Yep.
and then they did a what's it called, a genetic exam, a
Yes.
genetic, and told us that he had a genetic mutation that not that I and
Yes.
Dad don't have.
Right. And they tell that to every parent that I have worked with their child with seizures. Every single one. And what they're not telling the parents is that these genetics, these genes can be deactivated by removing underlying toxins and infections, that it's epigenetics that rules the day, not genetics.
Hmm.
And I told that to one mom whose I don't know, child was, and she was the head of the parent genetic thing. And I just told her flat out, I think you're doing more of a disservice to people than you're helping people. You're part of the problem, not a part of the solution, unfortunately, because you what they're telling you as a parent when they say it's genetic is your child has no hope of getting better. And that's just a lie. That's wrong. So anyway,
Hmm.
so he is doing better. So they said it was genetics. And then what had happened? He was kept having seizures. He
Yes.
would have seizures when he gets sick. What bring us up to date and then when you started working with me.
And then they just continued adding the medications. They started with clobazam, and then
Yeah.
they added Depakote, and
Yeah.
then this. Whenever we started with you, they added another one that's the Epidiolex.
Yes.
So then we reached out to you because we didn't want them. The next step was removing
Yeah. The
the
boomer. And so that's the protocol. And I've had other young patients, child patients, children patients, where they'll get them on 4 or 5, 6 different meds. They'll get up to the maximum dose. And then that's when they start saying, yeah, we have to do a temporal lobectomy. We have to remove a part of the brain. What they're not telling patients, and this is what gets me very angry, is there's no guarantee with that surgery that the seizures will stop. They may lessen the seizures, they may decrease in frequency, they may decrease a little bit in time after the surgery, but there aren't any guarantees. And the parents aren't getting that message. And that's unfortunate because I've worked with patients and helped them that have already had the surgery, their child has had the surgery, and it's a tougher road and it's a lot longer to work with the patient, but we've gotten them better and improved them because the seizures didn't change even after the surgery. So maximum medications. You're not sure what to do. Obviously, there's a lot of fear for your child, right? I mean, my goodness.
Yes.
And so you contacted me. We start working together. We're at about 3.5 months in right now. First time we spoke to you guys, it was 1 month in, and he was already seeing good change. So now you mentioned to me he just had a couple seizures. He gets seizures when he gets sick.
Yes.
So that's immune system is down. How long are those seizures lasting now?
Now they're like 10 to 15 seconds each.
They're just very short time.
Mm-hmm.
Yes.
Yes.
So continued improvement. We're continuing to move forward. As I tell everybody, this is going to take, a good year to get all this together and get his neurons stable and get him away from that threshold, as I've talked in many videos. So one thing you did mention to me after the call the last time was like, well, if English isn't my first language, Spanish is my first language.
Uh-huh.
So what I want you to do, because I do have many Spanish uh, viewers, I would say followers, is just tell everybody in Spanish in your native tongue what's been going on, how you feel, how the care is going. I have no idea what you're saying because I don't know any Spanish. So you can say Dr. Johnson is full of it, and I wouldn't know. I would just sit here and smile, but that's okay. So just, yeah, why don't you just let everybody know how you feel about things in Spanish?
Oh, do you want me to tell like this story, like a short?
Yeah, yeah, that would be good. Yeah,
Well, mi niño empezó a tener convulsiones cuando cuando tenía 3 meses. Le duró como 30 minutos y de allí le empezaron a agregar muchos medicamentos. Le empezaron a poner el Keppra, Clobazam. Ahorita toma 4 y le querían quitar parte del cerebro y no estábamos de acuerdo con eso. Es cuando empezamos a hacer el tratamiento con Dr. Johnson y las convulsiones le bajaron de 5 a 6 minutos a ahora solamente le duran 10 a 15 segundos. Pero sí, le ha funcionado bastante. Ya,
good,
ya,
perfect.
ya.
See, now that wasn't so hard. Nothing to be nervous about, right? It was
Ajá.
very, and I didn't hear you say Dr. Johnson loco, like
No.
crazy. So that's a good thing.
Ajá.
Even though, as I've mentioned many times, I'm crazy, but I'm the good kind of crazy, not the bad. There's bad crazy, there's good crazy. Now, some of those neurologists out there, I must confess, are a little bit crazy, but I don't know if they're the good crazy because just to keep loading young children up with medications when there is a natural alternative. And then they dismiss that alternative. And especially when they're talking about removing a portion of your child's brain, I think that's crazy.
Mhm.
That really is. So
And then
good.
his
Yeah, go ahead.
neurologist is about to, I think in May, he's gonna start decreasing one of his medications, the Keppra, because he's doing better.
Well, that was my next point. I never,
Mhm.
ever, it's illegal for me to tell any patient to stop taking meds or
Mhm.
decrease medication or even take medications. I always refer back. So I'm glad you brought this up. I always refer back to take them to the doctor. The doctor will decrease it.
Yes.
And
Uh-huh.
I mean, it gets to the point where the brain habituates to the meds anyway. That's why they have to keep adding meds. So it gets used to it and then they keep adding them. So that's exactly what we're working toward eventually to have your son off all meds, no seizures. And a year from now, he should be there. That's what I'm expecting. So, all righty. Anything in closing?
Mm, well, I mean, no, not at the moment. Yeah.
Very good. Well, listen, thank you for
Well,
being on the call. I greatly appreciate it. And we'll just keep moving forward and getting your son better.
thank you.
Thank you.
Hmm